Now, how did you do same day treatment and not run into your regular scheduled patient's appointment?
Yeah, that's a good question. So you have to set the expectation for same day treatment. Emergencies versus hygiene, okay? They're like a regular patient didn't have a problem but wants to get it done. So emergencies will obviously be pretty easygoing with you not being like consistently in the room. Like they'll whatever, like if you can take this pain away, I'm good. I don't care if I'm here for 4 hours. Because it might take that, right? So emergency cases are pretty straightforward. I would just tell the patient, look, I mean, I'm fully booked today, but I really want to help you. Is it okay if this takes like 3 hours? Like you can get up, you can go to the bathroom, whatever. We'll get you something to drink if you need some juice or something, if you're feeling kind of, whatever, like we'll work with them. But if I can squeeze an endo into my morning that wasn't planned, hey, that's a pretty good boost. Like I'll take it, by the time you're done with the filling, it's like $1,500. So I would do those, but I would be in and out.
Right.
And I would park my backup assistant in there to in and out anyway, like close to the room, so they can hang out with the patient as much as possible. Give them their cell phone, give them headphones, let them watch TV, But then I would roll in quickly with my lead assistant. We would do the next step, tell them, okay, now this has to sit for a little while. We'll come back and, complete the next step and back to the next patient. And I would just keep rolling like that, right? And get it done. With the hygiene patient, let's say it was a couple small fillings. It was my favorite thing out of hygiene, by the way, was upper or no freezing, because upper freezing is fast and no freezing while there's no freezing. So I could set up while the hygienist is finishing the hygiene appointment. So my backup assistant would go in, set up the room around them. So they would, picture the infection control protocol for this. So they would go in with their bin of stuff. It's the patient's already contaminated the room with their, aerosol, so it's no issue. We can go in and we can then open everything and have it all ready, and then they can exit the room, and then we would go in and just do the work, right? If I could, while the patient was still having their hygiene appointment done, I would give them the local, so that when they're done, we could literally start. So you want to juggle this stuff in your mind, like, you're trying to figure out, like, okay, well, what step would come next, and how could I do that now instead of waiting, right? So it's a little bit of juggling plates, but it's not complicated. You could figure it out, right? Anything that where I thought would put me behind more than 10 minutes, I would probably push to another appointment. By the way, all of this runs on the assumption that you work quickly. If you're slow, then you got to hurry up. I mean, this is a hurry up game, like dentistry in general, right? Like I tell most people, you could shave a unit of time off of every procedure in your day for your entire schedule for the day, and you wouldn't run behind. You just take the time you have. For a lot of people, if we can't get them past like $300 an hour, I say, send me your schedule. Okay, here's what you do. Cut 3 units off everything. Because you're taking forever. Like, what are you doing? 90 minutes for an MOD. Like, I don't understand. How do you think, what is it? Hurry up. So, bottom line, you should be clocking like $650 plus an hour. I like GPs around 800. That's a sweet spot because you're not running too hard, but you're productive. If you're there, you're fast enough. If you're at 500 an hour, you need to hurry up because you'll run into the next patient. Right. It's just a speed thing, really, at the end of the day. And it's not hurrying up the patient experience. It's hurrying up the treatment, right? There's a fine line. Like, the patient has to have a great experience, but you can hurry up and they can still have a great experience. You have to focus on that and make it often when people say I can't get beyond this, it's because they've never seen it. They have no concept in their mind how they can go faster, and they haven't put any energy into like getting faster. There are courses about basically productivity, like, how can I do fillings faster? There are also other members in the program that you can go watch that are producing $1,000 an hour. They can show you how to do it. And all it is stop dawdling. Like, use your assistant. Because a lot of dentists have the assistant there to hold the suction, and that's it. And I remember we used to have people come watch us when I was practicing more clinically, and they would see how fast we would pass things back and forth. And they would be like, amazed, right? So we are eventually going to create a training specifically on this. It's on the calendar, so it's coming up. When we have it, we'll announce it, of course. But using like true four-handed dentistry at speed is like, it's a game changer. Like if it doesn't add 50% to your day, I don't know what will. Like it's that important. So learning how to work with your assistant, calibrating with your assistant. If you're still reaching for all the instruments and everything yourself, like you're burning so much time. You have no idea. It's hours at the end of the day. So anyway, that's my story on how I would fit those things into the schedule. But really, the biggest bottom line item is hurry up.
Actually, that's a good question, because I have a lot of, well, not a lot, but some dentists say that like they don't have an assistant in the room, or
Oh wow, yeah.
like
It's like dental school. 3 hours to do a filling. Yeah.
how much of a big difference does it make, just to kind of?
Well, if you're slow, not much. But if you don't know the difference, it's because you don't know the difference. And I'm saying that like you need to know the difference. There is a huge billing per hour ability when you have not just an assistant there, but an assistant who actually knows what they're doing. And you as the dentist also then need to learn how to work with that person. Because you should never, like my goal in an appointment when I'm going, like if I'm doing a quadrant of resin, is to not take my focus from my loops off that quadrant. Even while I'm reaching for stuff, even while I'm dipping the brush for the bond and the primer, I don't want to have to look outside of my loops, because I'm losing focus, and it takes me an extra couple seconds to get back. You think that's minimal? It's not. It's huge. A quadrant of resin is like less than 60 minutes, okay? Because, I mean, dollar per unit of time is how I schedule. Now, I still had time to make notes. I still had time to give a great experience to the patients, and my work was good.
It was.
I've never had a problem with the work. So, you know, you can go quickly and you can do a good job. You can go quickly and you can make a mess. So you're not going to overnight make the change. You're going to grow into it, because you still have to maintain the quality. If your quality starts to stumble, now your schedule is going to be full of sensitive teeth, and, you know, filling fell out, and like you don't want those problems. You always want to be known for quality, but speed is where the profit lies, right? Because if you have two dentists side by side and they both produce equal quality, but one takes twice as long, then one's making money and one's not. Especially in an inflationary environment when everything's going up, and, you know, issues that we've been dealing with for the last little while. So you don't have the luxury of dawdling. Like, you know, I would rather, and we did this, get more done in half the time and go home. Right? Why stretch it out till 5 or 6 o'clock? Why stretch it out 4 days a week? Right? So I tell people this, and it's true, and you can vouch for me, and call me out if I'm lying. We went from 4 days to 3 days. No change in production, went up actually. 3 days to 2 days. We just shoved it in, right? And just hurry up. Just get it done. Just look at like, so I got, you know, the lean concept, right? It's a big deal maybe 10 years ago, right? It's common knowledge now that if I can touch things once instead of 5 times, if I can simplify instead of having to think every time to just make it reactionary, then everything goes so much faster. So I would look at, where are the points of drag in this appointment? Like, where am I waiting for someone else? Or where am I sitting and not idle and not doing something? And how can I positively impact that, right? And if you just look at all the dead time in an appointment, you say, well, how can I get rid of that? And you start realizing, hey, you know what? If we did this way and this way, and we did this in this order, and you start thinking in that way, right, then everything is so much quicker. And by the way, just as a little teaser for the assisting that we're talking about doing an assisting video, like clinical assisting, how to like actually do a four-handed operation. Your assistant can hold 4 instruments in their 2 hands, like 2 in one hand and 2 in the other. You can do that. Why would you ever need to reach for something? It doesn't have to be an instrument. It could be a tube of etch. It could be a tube of flowable. It could be the bond dish and a brush. It could be like, so you never need to go anywhere besides where you are. If you stay focused and you just go, then you're NASCAR fast. You're not like, dawdling around reading the manual. Like, you get it done. Now, that's the big difference. I think I really just beat that up now. So
that's
let me
awesome.
stop talking.
No, that's huge.